Hi, I'm Dr. Nicole Nemeth here at Plastic Surgery of Westchester, and today I want to talk about placement of the implant. Do we place it in front of the muscle or beneath the muscle, and why would we do one over the other? So majority of the time, the recommendation is going to be to place this implant behind the muscle and also drape it behind the breast tissue. So it's kind of a dual plane approach in most cases. And we do this when we're doing an implant approach for breast augmentation, or when we're doing an augmentation with a mastopexy and something along those lines. So the reason we place it behind the muscle is first because it's going to create some coverage on that upper pole of the implant. So if it's behind the muscle, that muscle will help hide some of those irregularities such as rippling or visibility of the upper part of that implant. The reason why we might place it in front of the muscle is if that person did not want to have a breast lift, for example, or for some reason they wanted to avoid placement behind the muscle and some of the animation deformity that the muscle can create when you flex the muscle on an implant, such as in a bodybuilder. But those cases are very unique and very specific and would of course depend on the consultation. The most common reason why we would recommend for most people to place it behind the muscle is to prevent capsular contracture. We want to lessen that risk of that implant capsule kind of tightening around the implant or squeezing on the implant, which can cause a visible deformity, and it can also cause pain or discomfort. So that would be probably the number one reason why most of the time we want to place that implant underneath the muscle. So speak with your surgeon and come for a consultation so we can discuss this.